Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the blood supply of the rectum and anal canal. The blood supply of the rectum and anal canal is primarily provided by three main arteries and their branches. These three main arteries are the superior rectal artery, middle rectal artery, and inferior rectal artery. The superior rectal artery is a branch of inferior mesenteric artery. We know that inferior mesenteric artery is a branch of the abdominal aorta. The superior rectal artery supplies the upper portion of the rectum and upper part of the anal canal up to the pectinate line. Course of the superior rectal artery. This artery descends along the posterior aspect of the rectum, dividing into smaller branches as it supplies the mucosa and muscles of the rectum and anal canal. Okay, so this is the superior rectal artery. This is a branch of the inferior mesenteric artery. So superior rectal artery is a branch of the inferior mesenteric artery, and this is the middle rectal artery. This is a branch of the internal iliac artery. Okay, and there is a branch of the inferior rectal artery. This is a branch of the internal pudendal artery. Internal pudendal artery again is a branch of the internal iliac artery. The middle rectal artery from the internal iliac artery, this artery is not very big. It is a small artery. Even sometimes it may be inconstant, maybe may not be present, particularly in female. It may not only arise from the internal iliac artery, it may arise from the inferior vesical artery, even it may arise from the internal pudendal artery. The middle rectal artery supplies the middle portion of the rectum and contributes to the anastomosis with the superior and inferior rectal arteries. Its course, it runs laterally to the rectum, supplying the muscular layers only. So middle rectal artery is not supplying the submucosa and the mucosa. This artery is smaller than the superior rectal artery and has variable anatomy. Its origin is variable. It may be absent in female. The inferior rectal artery, inferior rectal artery. This is a branch of internal pudendal artery. Internal pudendal artery is a branch of the internal iliac artery. Okay, so we got that. Supply area supplies the anorectal junction, specifically the external anal sphincter and perineal skin. Course, the artery arises from the internal pudendal artery at the posterior end of the pudendal canal that is present in the ischiorectal or ischioanal fossa in the perineum. We have another artery what we have not mentioned previously, that is the median sacral artery. This is a very slender artery. It is the dorsal branch of the terminal part of the abdominal aorta. We have only one artery like this. Just above the bifurcation of the abdominal aorta, it descends in the median plane and supplies the posterior wall of the anorectal junction. So we have actually four arteries supplying the rectum and anal canal, including the median sacral artery. Venous drainage. The venous drainage of the rectum and anal canal generally follow the arterial supply with the superior, middle, and inferior rectal veins. Okay, so this vein provide the venous drainage of the rectum and anal canal. Venous blood returned from the rectum and anal canal by this vein The internal rectal venous plexus is present in the submucous of the anorectal junction. External rectal venous plexus is located outside the muscle of the rectum and anal canal. They contribute to the tributaries of superior rectal vein. The suprarectal vein drains into the portal venous system via the inferior mesenteric vein. Middle and inferior rectal vein drain into the systemic circulation via the internal iliac vein. So, rectum and anal canal is a site of portocaval anastomosis. Okay, so when there is increased portal portal pressure, there is portal hypertension due to any region, then this anastomosis will establish, and there may be swelling in the rectal mucosa, okay, due to the excessive venous pressure there. So that may lead to development of hemorrhoid or piles. We'll go to the next slide. Okay, this is the venous drainage of the rectum anal canal. Suprarectal vein contributed by the internal venous plexus in the submucosa, then around 7 centimeter above the anus will get the formation of suprarectal vein from the tributaries from the internal rectal venous plexus. Is also external rectal venous plexus, not only around the anal muscle, also around the rectal muscle. From there, we'll have the tributaries of the rectal veins. We're getting here the suprarectal vein, the internal iliac vein. Venous blood will drain into the internal iliac vein. There's another route of venous drainage by the middle rectal vein. Then the inferior rectal vein, okay, that is draining into the internal parental vein, that eventually drain into the internal iliac vein. So this is the systemic circulation. This is the portal circulation. So there will be anastomosis. Okay, there is anastomosis, but it will be very prominent in portal hypertension, like cirrhosis of liver cancer, increase intracranial pressure during pregnancy. There will be increased pressure in the venous system, and that may lead to piles. Clinical anatomy, portosystemic anastomosis, the rectum and anal canal have a significant portosystemic anastomosis at the junction of the superior and inferior rectal veins. Increased pressure in the portal system, such as portal hypertension by cirrhosis of liver, hepatic cancer, can lead to the development of hemorrhoids in this area. And that's all about the blood supply, arterial supply, venous drainage of the rectum and anal canal. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.